Hey, Team BCN. Thanks so much for joining me for today's podcast episode. Danita Ross, Vice President of Human Resources at Bluegrass Care Navigators, joins us today to tell us a little bit about herself, her role at Bluegrass Care Navigators, and talk about the changes she's seen in her 25 years with us. Danita, thanks so much for joining us today.
Thank you for having me. I appreciate the opportunity.
Absolutely. I've been looking so forward to our conversation. You have been working at Bluegrass Care Navigators for 25 years now. How did you get started working at BCN?
We ask our new team members this question in onboarding, and normally the response is, I had a family member in hospice, or a hospice provides services at a facility that they have worked in, and that our team members seem to be happy working for us and say good things about us. I didn't actually have that experience. I do wish that I had known about hospice, but I knew nothing about hospice. And I wish my husband's mother had been referred to hospice. She died in 1994, which was 4 years before I came here. And she was discharged from the hospital one evening. She got to our home around 7 p.m. And they didn't really do a good job of describing her condition or anything like that. And she actually died the following morning.
Oh
So she was
my.
she was only in our home probably 12 to 15 hours.
Mhm.
So, my path was different.
Mhm.
And, it was all about networking and connections. So there was a Central Kentucky Healthcare HR group that I was involved with. I worked at a hospital outside of Lexington for 13 years. And I had gotten to know the HR directors, whether it was from the Berea Hospital or the Georgetown hospitals, all the hospitals in the area, including the Lexington hospitals, Lexington Clinic, HR, all of those folks. And I saw the ad. That's when there was really newspapers with employment ads. And I reached out to the current HR director, who was Barry Lindeman. And, he, talked a lot about what hospice does, about the organization itself. And I became very interested. So I had the interview here. It was all grace that I was hired, and not knowing about Bluegrass Care. Well, at the time, it was Hospice of the Bluegrass. So, Gretchen Brown was the CEO at that
Yeah.
time. She was part of the interview team, and she was very welcoming. So, I just really appreciate, getting the opportunity to come here, but it wasn't because I knew about hospice. So my story was a little bit
Yeah.
different.
Yeah, that's fascinating. Thank you for sharing that part of yourself with us. So you're now Vice President of Human Resources, but I'm assuming that you didn't start in that role. Maybe you did, I don't know. What was your career path like?
So my career path was that after I had graduated from college, I thought about human resources primarily after I had taken an industrial psych course. And, they really got into the different studies and what affects employees, whether it's lighting, heat, light, all those types of things. And it just was very fascinating to me. So that was what I felt like I was being led to.
Mhm.
But I had a difficult time, going to the job fairs, finding a job in HR because most of the companies they were either looking for the engineering students that were fresh out of college, but they weren't really looking for, HR.
Mhm.
And then those who were looking for HR wanted someone with a lot of experience.
Right.
So, my first boss in HR was at a hospital outside of Lexington, and I went there. Well, actually, I started at the employment office, and the lady that was in the next cubicle who had been helping another person, they knew about a position, and the other person had already taken a job. So she called the HR director at the facility, and he said, "Come right on over." And it was so interesting because that day they were expecting, it was in December, and they were expecting a huge snowstorm. But I went
Hmm.
ahead and, I got on the highway. I went there. I filled out an actual application there. There wasn't any online. And he pretty much offered me the job on the spot. It was a
Hmm.
personnel assistant or personnel secretary, is what it was called at that time.
Hmm.
And I had to be able to type. And so I had taken typing in high school, and of course, I was really good then. But throughout college, not everybody had typewriters, and there were no laptops, computers, and that kind of thing.
Hmm.
And my sister actually always wrote my papers for me, or typed them for me, rather.
Uh-huh.
And so they gave me a typing test. And I'm like, oh my gosh, I was typing like maybe 28 words a minute or something. And I don't
Yeah.
know what that means to you, but 60 was pretty much the average.
Okay.
And he just said, I'm going to hire you anyway. I love, your background, with your education, but you need to work on your typing. And so I did. In that first 60 days, 90 days, I increased my typing speed. So
Wow.
that was my challenge versus HR being my challenge. But I learned so much from him. He was originally from Blacksburg, Virginia. He went to Virginia Tech. He and his wife had adopted a daughter from Korea, and they were just very welcoming. And it was a small, close knit community, small facility. I thrived there. Within a year and a half, he accepted a position back in Virginia.
Mm.
And so I moved up. They promoted me, but not to the director of human resources. They did some combining of several services, marketing and HR. And
Hmm.
so I did report to the marketing person, but I was can't remember the title exactly, but primarily I headed up HR. And then in probably another year, that person left, and they split the position out, and I was the director of human resources there. So I moved pretty quickly
You
there.
did. Yeah.
And then as time went on, I was promoted to vice president of human resources there. So I was part of the management team, the senior management team there
Okay. Wow.
until I
That's
came here.
that's awesome, Danita. So what was your first role at Bluegrass Care Navigators?
Well, my first role, and I feel like I took a step back to go forward
Hmm.
because the title here was director of human resources.
Okay.
Where I had been the vice president of human resources there. It was still on the senior leadership team. It just had a different title.
Hmm.
And then as time progressed, I was promoted to vice president of human resources.
That's awesome. That's awesome. I I always think it's interesting. You were talking about at the career fairs you went to that people in the HR field or in any field really, they want to hire somebody with lots of experience. But my thing has always been, well, I'll get the experience if you'll hire me, but I'm 22 years old. So how can I have had any? But I'm willing to do anything.
Exactly. And I was probably, when I started out, I was probably 22. Well, I had worked 1 year prior to getting into HR after, graduation, a year and a half, I think. So I was young too, mid
Hmm.
20s.
Yeah. Yeah. Do you remember your first day or your first season at Bluegrass Care Navigators and what that was like?
I do remember the first season because I had, given my notice at the hospital, and that last week we had what was supposed to be flurries. We had pretty much like 16 inches of snow.
Oh, right. I remember that.
Yes, and that was in 84. December, well, January, February of 84, 85, and so I ended up, well, the following week, of course, I could, get off of my street, whereas that week I could not get off my street until near the end of the week, and I
Right.
ended up finishing things out on Saturday at the hospital, because I was snowed in
Mhm.
the beginning of the week. But everyone here, hospice is a family. and everyone was so nice. Everybody was looking to see the new kid. Of course, being African American, I was I guess, only African American senior leader.
Wow.
And, I would see some of the CNAs would come by my office and look in like, is this real? And I remember Sandy Gowdy. She was always very nice. Sandy Gowdy has been here over 25 years. She was always very nice and sweet as well. But I mean, everyone was very welcoming. I do
Yeah.
remember that first month when we had our onboarding, we called it orientation. I was expected to do the orientation for the new group. And the new group included the Jessamine County hospice team members. We immediately, like in that first month, is when the merger with Jessamine County Hospice occurred.
Okay. Wow. So you were kind of onboarding yourself.
I was onboarding myself. I didn't know a lot about hospice, but I did know about HR policies, employment policies. So it was a little different.
Yeah. How have you, I mean, because I recently came through the onboarding process and just hearing you talk about it, I'm like, oh, wow, it has changed so much. I mean, can you talk a little bit about the work that you put into making the onboarding process what it is today?
We've always worked as a team. So I'm not going to take credit for the onboarding process, specifically myself.
Hmm.
But we've always worked as a team. And starting out, when I first came, it was very similar to what we do now as far as hitting all of the aspects, but it included more clinical
Hmm.
onboarding and pretty much the hospice journey from beginning to end, including, what happens with, after the death with bereavement, death and dying.
Hmm.
So that was a very, and that was already in place when I came. What I had effect on was primarily the HR portion and how to, conduct the HR part of the onboarding. As we have continued, we always had an education department that, worked on the presentations and those types of things. But we did make a change, and I can't remember how long ago it was, maybe 3 or 4 years ago, when we added the professional development component
Hmm.
to cut out a lot of the videos. We used to do more videos,
Hmm.
and we really wanted to have a presence, and everyone from any of our service areas that came to headquarters for onboarding, we wanted to make sure that they met as many of our team members as possible when they were here,
Hmm.
because this may be the first or last time that they actually would see us in person.
Right.
So
Right.
that really was a big impact, I think. And before COVID, we actually would have our senior team members, we would have at least 3, maybe 4 to have lunch with the new staff that was coming on board, to get to know them
Hmm.
and to welcome them here. And of course, through COVID, we did Zoom
Hmm.
onboarding for 2 years, and then we went back to the regular onboarding. And we're now in this building, and we were still trying to distance, even though we were doing onboarding in person, we still had to distance in the room, and we did not eat together. I mean, we had to spread out as well. So
Right.
we have not gotten back to having our senior leaders have lunch yet, but hopefully this year we will get back to that practice.
Yes. Well, having recently completed the onboarding process, I really felt part of the team after having done it, and it happened so much more quickly than anywhere else that I've worked prior to here because it was just it let you meet people and it just helped me feel really involved and integrated right from the beginning.
Well, I'm glad to hear that. It's
Yeah.
always good to have that feedback.
Yeah. So, it made me feel really very much part of the team, and so
And
yeah.
so you were on the team that played Jeopardy and your team won.
Yes, no thanks to me. I just happened to be on the team with somebody who was, more competitive, shall we say, than I was. In the BCN world, we were known as Hospice of Bluegrass when we started and have since changed our name to what we are today, Bluegrass Care Navigators. And as Navigator Notes mentioned in the February 21st issue. In the larger world, a gallon of gas was $1.06, minimum wage was $5.15, and eggs were only 88 cents. The highest rated TV shows were ER, Friends, and Frasier, and the Denver Broncos won the Super Bowl that year. So I'm curious about what growth or changes you have witnessed during your tenure at BCN.
When I first was interviewing, I
Hmm.
remember Gretchen saying that we had 225 employees.
Wow.
And that is when I started, I want to say that there was more than 225. It maybe was more like 270 employees. I'm
Hmm.
not for sure, but
Hmm.
there was more. But this organization has grown phenomenally over the years. As I had stated before, the merger with Jessamine County Hospice occurred,
Hmm.
almost immediately. They, March, I believe it was March 16th, March 17th was when they
Hmm.
came on board. So, that continued. Working for a hospital, there's more red tape as far as being able to do things and to progress, the approval processes, the testing. But when I came to hospice, if I had an idea or I wanted to try something different, it was always, go for it. Give it a
Hmm.
try. And that was the philosophy that all of the team members had was, I think we can do this. I think we can. Shortly after we merged with, I believe the next facility was Harlan. And I remember all the trips that we would take down there back and forth. And that was a 3-hour drive at the time.
Hmm. Hmm.
So we took on additional team members, additional service areas, and we continued to grow. The next area was we opened another inpatient unit in Northern Kentucky. And it was at the St. Luke facility, which is now St. Elizabeth. So we're no longer there. But it was just growth. It was always something new, something challenging. It hasn't been stagnant at all.
Hmm.
And this growth has continued. I remember when we hit over 1,000 patients, and that was probably in 2010 or 2011. And then we had a large pediatric population. So we had a booming pediatric program.
Hmm.
When I first started, we only had one physician, and that was Dr. Gutzel. And now we probably have 15 physicians and
Yeah.
all of these
Yeah.
nurse practitioners. As we have grown, I just can't get over the growth being with this organization.
Right. Right.
It's not stagnant. We have continued to, change and to do a variety of things. One of the things that I brought to the table was the 401k.
Hmm.
We had what was called a simple retirement plan, SRP, or I can't remember the term,
Hmm.
but it was a little bit different. A lot of our staff, they really didn't know what they had. They just, they weren't very pleased with it.
Hmm.
So at the hospitals could have a 403B versus a 401k.
Okay.
And so we did an RFP. We talked to several companies and we instituted the 403B around 2001. My
Hmm.
dates may be a little bit off,
Yeah. Yeah.
but that was a big achievement for me.
Yeah.
And also to transition to being self-funded for our health insurance, which saved us a lot of money because you weren't just paying the insurance company to administer the plan and for what they anticipated your costs were going to be.
Hmm.
So those were the two big things that I accomplished early on.
Yeah. Like very early on. Because you would have come in 1998 and were making significant changes very shortly after you arrived.
Yes, and again, I had the support, of the CEO and the other senior leaders, and the employees were very pleased with our 403B and the company that we selected. They felt that they were more connected to the plan.
Hmm.
They were able to save more on their own.
Absolutely. Well, thank you, Danita, for sharing the history and the changes that you have witnessed and also helped to put into place. I know our team is all very grateful for that. In your current role, how would you describe your role as Vice President of Human Resources?
Okay, that's a good question. So over the years, when I first came, there were only two employees in HR, myself
Really?
and an assistant. And as time has changed, and as the number of employees has grown, HR department has grown as well.
Hmm.
And most recently, in the last, I believe, 2 years, I was able to promote one of our team members, Jason Acock, to HR director. And I was the VP of HR. And before I was more hands on, because there are fewer of us. But now that, Jason has taken on that role, he handles most of the day-to-day types of issues that come on. My role is more strategic and looking at the overall goals for Bluegrass Care Navigators and how HR can support the clinical team, the growth of the organization, and coming up with ways to improve our organization.
Yeah, absolutely. You asked this question, or it gets asked in HR onboarding. What's the best part about working at Bluegrass Care Navigators?
Ken, I'm going to say the best part is that this organization is not stagnant.
Mm,
Best part is that, it continues to grow,
hmm.
and we are continued to be challenged. And of course, number one is the people. I believe that the people who come here have a heart for hospice. They're very humanistic and they want to help those who are in our services, whether it's end of life or our new programs with PACE and home health, but they have a caring heart and it's really about the people.
Mm, that is so true. So we all have difficult days, no matter where we work, whether we're on the admin staff or on the clinical team. There are just things that happen that make life a little difficult sometimes. Can you tell me a story that keeps you going when it has been a little bit difficult?
Probably the most difficult story was when we did have a staff reduction in 2012 and 2014.
Mhm.
That was the most difficult because, again, it's the people who make Bluegrass Care Navigators. And it was just very hard talking to people that you have worked side by side with for so many years
Mhm.
and to determine, who's leaving. The 2014 reduction, we actually asked people, if they wanted to leave. So they kind of self-selected in the beginning, and we
Mhm.
lost a lot of history. That was a hard time. And
Mm. Mhm.
I have a strong faith in God.
Mhm.
And I think that without having a strong faith in God and knowing, that, we're going to get through this. We may be in the valley now, but
Mhm.
we're going to get through it and we're going to come out stronger.
Mhm.
And that's, it's my faith that helps me through difficulties and
Yeah.
difficult times.
Yeah, absolutely. Absolutely. Danita, this has been a wonderful conversation, and I've really appreciated just this little snapshot that I'm sure there's much more, but just the snapshot that you've given us of a little bit more about who you are. And I have one question that I ask everyone who comes on the podcast. But before I do, is there anything else you'd like to say that we haven't already talked about?
Yeah, I would just say that, this coming to this organization, and I know we're coming up on Women's History Month,
Mm-hmm.
but it has always been very strong women who have worked here and have brought Bluegrass Care Navigators to where we are now. And I would be remiss if coming off of those years where we had the staff reduction and we weren't growing as much, having Liz Fowler come on board in 2014.
Mhm.
She just had a different outlook, and she has really helped this organization to grow
Mhm.
and to rebound from where we were. So she's a strong woman. We have had lots of strong women here. The majority of our workforce is women,
Yes.
and that's I had not my previous employer was pretty much primarily men in leadership.
Mhm.
And there may have been 3 or 4 women, the director of nursing, the director of respiratory and radiology or dietary, but pretty much it was a man's world.
Mhm.
But here it is different, having the strong women. The other big difference is when I started out, no one had computers but accounting.
Oh,
And now
wow.
the technology, that's a way of life now, and
Yes.
I've learned a lot, and we're able to do, so many things having the technology.
Yes, for sure. I hadn't even thought about the technological changes that would have happened in 25 years, but that's amazing.
It is amazing, and to look at how many team members we have in IT. When I
Uh-huh.
first started, there was a contract company with 2 people. And primarily it was desktop computers. It wasn't
Mhm.
even laptops. So
Wow.
yes, and now that we have all of these laptops, probably I don't know how many are out there in the field, but probably 700 to 750.
Yes.
Um,
Yes.
since we're right about 780 employees, so I'm going to
Yes.
say that there's all of these laptops.
Yes. Yep. Yep. For sure. For sure. Danita, you've already shared quite a bit about yourself, but because this podcast is about getting to know our team members, what is one thing that others may not know about you?
I would say that most people don't know that while I was in college, I still worked in healthcare. My mother always said that you should get a job in healthcare. She wanted me to be a nurse or a respiratory therapist because she was a respiratory therapist.
Mhm.
And so I actually worked as a CNA. I was a nurse extern at Baptist while I was in college. And I also was a phlebotomist while I was in
Wow.
college. So I don't know if a lot of people know that about me,
That's
um,
awesome.
but I have pretty much been in healthcare the majority of my life, more than 25 years. Well,
Wow. Well, and in your current role, even though I know things in healthcare have changed in the CNA world and things like that, it gives you a little bit of insight into what that job is like, you know?
absolutely. And I think just having that experience that summer at Baptist, I did baths and made beds and, all those types of things that CNAs do. I thought it was difficult working with patients.
Mhm.
There were some patients, of course, that were very easy, and then there were some patients that weren't. And, it really made me take a look at, is this what I want to do?
Mhm.
And I was in nursing school at the time. And so I just took a really hard look and decided, I don't think this is where I'm supposed to be
Right.
and what I'm supposed to be
Yeah.
doing.
Yeah. Yeah, you definitely have to, for anything you do, you definitely have to know that you love it because there's going to be good and bad days, and you have to know you love it, especially on the bad days.
Right, right.
Yeah.
And I do remember that summer is when Princess Diana, the wedding for Princess Diana.
Oh, yeah.
I remember I was working that day and a patient had the TV on, and I was like, wow, it was, yeah, that's what happened during
Oh,
that time as well. That was in, I don't know what the dates were, but probably 80
okay.
or somewhere in there.
Yeah. Yeah, I've seen pictures. I don't remember that, but I've seen pictures of it. And, when Megan and Harry got married, I got up at like 4 in the morning so I could watch it.
Oh, yeah,
Yeah.
yeah. And yes, the
Yeah.
royal weddings have occurred during my career as well.
Absolutely. Well, Danita, thank you so much for your time this morning. Thank you for your commitment and faithfulness to the work you do at Bluegrass Care Navigators. And it really benefits us all. And I'm just really grateful for you and for who you are and the work that you do here.
Thank you very much. I appreciate this opportunity.
Yeah.
And, people have wished me another 25 years. I don't know that I will make another 25 years, but if I could, with my health and body, could work another 25 years, this would be the place I would want to be.
Well, that is very good to hear. That's a very high compliment to the company that you work for. So thank you again for sharing, Danita.
Thanks, Heidi.